What is fasting? Fasting simply means not eating for a period of time. It's not about what you eat or when you eat. In this video, we'll cover from the basics of fasting and how to safely begin. Let's jump right in. Humans have been fasting from time immemorial, sometimes because food was scarce, and sometimes for religious or cultural purposes, and other times due to health reasons. The beautiful thing about fasting is that our bodies were designed for fasting. I mean, you fast when you sleep. So now let's talk about the different types of fasting. We have the intermittent fasting that has to do with time. And of course, we have religious fasts and we have extended fasting times. Lastly, we also have medical fasting. So we're going to talk about common fasting variations. We have the first one, which we call the 16-8. The 16-8 method says that you have 8 hours in the day as your feeding time. Okay, so you fast 16 hours and then you eat within 8 hours. Then, of course, we have the 18-6 method where you fast for 18 hours and then you eat in a 6-hour window. You also have the one that you fast for 20 hours and you have a 4-hour window to eat. There's another one called the 5-2 method where you eat for 5 days and you fast for 2. And in those 2 days, you don't eat anything. Or you can eat about 500 calories. And then we have the one that's called OMAD. I'm sure you've heard about OMAD. OMAD means 1 meal a day. It's a 24 hours fast where you eat 7 p.m. today and eat 7 p.m. the next day. So every 7 p.m. you eat. Then we have 36 hours fast where you eat on day 1 and then you don't eat until breakfast on day 3. And of course, we have the 36 or more hours of fasting. Those could be due to any from medical reasons to maybe for a surgery or something. But that must be done with the advice and supervision of the medical team. Those are the different variations of fasting. Most beginners start with the 16-8 fasting method. There's a myth that says breakfast is the most important meal of the day. You should not skip breakfast. That is not true. You can miss breakfast and be healthy. Okay, so take that out of your mind when we're talking about fasting. You can skip breakfast. Now we're going to be talking about what happens in your body when you fast. Between 4 to 16 hours of fasting time, your insulin drops significantly. Your body begins to burn stored glycogen from carbs that are stored in your liver and muscles. Between 16 to 24 hours of fasting, this is where we call the fat burning stage. This is where fat burning begins. So fat burning does not begin until after 16 hours of fast. This stage is where your body begins to eat its own fat because glycogen has become low. Okay, so it needs the stored fat to continue to work in your body. Then your liver produces what we call ketones in between the 16 to 24 hours. This is the brain's backup fuel. From 24 hours and above, we call this deep ketosis. In this stage, what we call deep ketosis, fat begins to burn vigorously. Autophagy begins. Autophagy means like your cellular cleanup and repairs, where your body begins to heal itself. And then it gives you this mental clarity. At this point, hunger is diminished. That means you don't feel hungry, you don't crave sugar. And this is why fasting is so powerful. Let's understand what ketosis is. Ketosis is when your body switches from burning sugar to burning fat. Your body runs on carbs. Carbs are converted glucose. It's quick energy, but it requires constant refueling. In ketosis stage, glucose runs low during fasting. Then the liver converts fat to ketone. And this is steady and long lasting, right? It keeps you fuller. Some signs that you are in ketosis during your fast. You have reduced hunger and reduced cravings. You have stable energy because you have enhanced mental focus and sometimes fruity breaths from the progression of acetones. Then you will see noticeable fast loss like this ones you will see with your eyes if you embark on these different variations of fasting going up as you progress. Why should you fast, you may ask? There are different, very healthy reasons why you should fast. Remember, I first of all said that our body systems were created to fast. Okay, when you sleep, throughout your time of sleeping till you wake up, your body is fasting. Okay, so your body can handle it. Fasting supports weight loss. It improves your insulin sensitivity. It gives you a better sugar control. Fasting has also been known to reduce inflammation and reduce the risk of heart diseases. Fasting also boosts mental clarity and focus. Fasting triggers your body to autophagy, which is your cells beginning to repair itself. And it helps to break constant eating habits. that urge to always be eating something, that binge eating. Fasting helps curb those desires. Fasting also simplifies meal planning. Fasting is not suitable for everyone. Consult your healthcare provider before starting, especially if you have medical conditions or you're pregnant, you're breastfeeding, you're underweight, or you have a history of eating disorders. Now, let's talk about how to fast for weight loss. You don't just wake up and say you start fasting. You have to plan for it. And you have to walk with your body. Start small, don't rush. In my previous video, I talked about how that fat loss is not a sprint, it's a marathon. Okay, so you start small. Say you eat 3 times a week and you want to start fasting, or you want to start taking your health seriously. Skip one meal, skip breakfast, eat 2 meals within 6 to 8 hours. Let that be your eating window. For example, you can have lunch at 1 and have dinner by 6. That's a 6-hour window. And then, of course, after 2 weeks, you can advance and bring your eating window between 4 hours. From there, maybe give yourself another 2 to 3 weeks. You try OMAD, the 1 meal a day method. Okay, the 24 hours fast. Only do longer fast when you're comfortable, when your body has adjusted. Okay, remember, fat loss is a marathon, not a sprint. Okay, consistency over intensity. These are the things that you should keep at the back of your mind when you want to engage or embark on a fasting protocol. You could also try a 36 hours fast, an advancement from the 24 hours fast. And then from there, you now have those variations of 3 days water fast, 5 days water. But please let it be with medical supervision. Don't do this on your own, because it could cause series of damages to your body, and we don't want that, okay? I'll show you the temporary side effects of fasting. These usually resolve within 2 to 10 days of fasting, okay? So you could experience fatigue for the first few weeks. You could have possible digestive changes. Like I said, they resolve, all right? So you just have to push and it will be resolved, okay? So let's do a quick recap. Fasting equals when you eat, not what you eat. Start simple. Your body naturally shifts from glucose to fat burning. Fasting plus ketosis equals natural fat loss plus mental clarity. Fasting is a lifestyle tool, not a quick fix. Always consult your healthcare professionals before you embark on very drastic fasting. Have you ever tried fasting? If yes, what method works for you? When I wanted to start my weight loss journey, I first started with 1 meal a day, hand size of food, and it was carbs. Trust me, in 1 week, I had lost all my face fats, but it was not sustainable. I was exercising and I was eating once a day. I was so hungry most of the time. I had to retreat. I had to start again. So I started eating 3 times again. With time, I found what worked for my body. Do what works for your body. If this video helped you understand fasting more, smash the like button, share, and subscribe. It really helps this channel grow and reaches out to more people who need to see this. Thank you for watching, and remember, your health journey is unique to you. Start where you are. Be patient and take it one step at a time. Give yourself grace. See you in my next video.